Good day, our esteemed panel members, our professor, and everyone present. Our group includes myself, Romel EBIO, Ms. Siti Hania Ali, and Mr. Paul Sescon, and we are honored to present our research entitled The Potential of Cooperatives Developed to be a Sustainable Alternative Solution Provider for Affordable Medical Supplies in Rural Areas in the Philippines. This study is anchored on two realities. First, healthcare is a basic human necessity. Second, many rural hospitals continue to struggle with the affordability and availability of essential medical supplies. As MBA students, we examine this issue through feasibility assessment of cooperatives' potential, focusing on organizational structure, operational efficiency, and long-term viability to determine the condition under which cooperative could function as a reliable model.
Healthcare demand in the Philippines continues to rise due to population growth, expanded health programs, and increased public awareness. However, access to essential medical supplies remain difficult, especially in rural areas. Many rural hospitals frequently experience shortages of basic items such as gloves, syringes, IV tubings, IV fluids, and oxygen cannulas. When supplies run out, patients are forced to source them from urban centers, resulting in higher costs, delayed treatment, and service interruptions. From a managerial standpoint, these recurring shortages indicate inefficiencies in the current supply chain, emphasizing the need for innovative, localized, and sustainable procurement solutions such as cooperatives.
The general objective of this study is to integrate the potential of cooperative as an alternative solution provider for affordable medical supplies in rural areas. Specific objectives are: number one, survey all medical supplies that has fast turnover rate but low replenishing rate. Number two, analyze potential cost of cooperative supplied medical supplies compared to existing supply chain model. Number three, evaluate respondents' perception in establishing cooperatives in the institution. Number four, the level of willingness of respondents in the process of establishment of cooperative. Number five, plan alternative revenue generating strategies to ensure the cooperative success.
The study utilized a quantitative research design using a structured questionnaire. Respondents were randomly selected employees from San Luis District Hospital, the El Nido Community Hospital, and Norsagaray Municipal Hospital. The questionnaires measured perception and willingness to participate in cooperative, as well as the affordability and availability of medical supplies. Surveys were administered in person to ensure clarity and accuracy of responses. This approach allows us to gather reliable, first-hand operational insights from healthcare personnel directly involved in daily hospital operations.
These slides presents proof of actual survey administration across three hospitals. It includes photos of respondents completing questionnaires across the three hospitals, department, and positions. From the survey conducted, we have come up with this comparison table of medical supply costs across El Nido Community Hospital, San Luis District Hospital, and Norzagaray Municipal Hospital. Information provided here include the top 5 medical supplies, which are frequently consumed and prone to shortages. Another is the cost comparison, which may establish a baseline for understanding current procurement costs and differences between internal inventory sourcing and external purchasing. The data show that items such as sterile gloves, syringes, IV tubings, plain NSS, oxygen cannulas, and other consumables are consistently more expensive when sourced externally compared to internal or bulk procurement. This can be used for benchmarking purposes in the future.
Several statistical tools were applied. Single sample t-test to assess high perception and average willingness against a neutral midpoint. Z-test compare willingness across salary groups. One-way ANOVA to examine differences by age and years of employment. Pearson correlation to analyze the relationship between perception and willingness. For merged data from three hospitals, we use chi-square test to determine if there is a significant association between age groups and the hospital. These tools allowed us to identify patterns, relationships, and group differences, ensuring conclusions are supported by quantitative evidence.
The statistics from El Nido Community Hospital include the frequency table, measures of central tendency, such as the mean, median, mode, and standard deviation. The frequency table shows that the largest group of respondents belongs to the 31 to 40 age group, indicating that El Nido Community Hospital respondents are in their mid-career stage. This is followed by the 21 to 30 group, while the 41 to 50 and 51 to 60 groups have fewer respondents. This suggests that respondents are largely concentrated in the younger to middle-aged workforce. Midpoint was determined in order to compute for other frequency data. As for the mean age of 34.50 indicates that on average, respondents are in their early to mid 30s, reflecting a workforce that is relatively young but already experienced in hospital operations. The median falls within 31 to 40 age bracket, meaning half of the respondents are younger and half are older than this range. This confirms that age distribution is centered around mid-career employees. As for the modal class is 31 to 40 years, which has the highest frequency. This shows that the most common age group among respondents consists of employees in their prime working years. For the standard deviation, which resulted for 8.45, indicates low variability in age, suggesting that respondents' ages are closely clustered around the mean. This reflects a relatively homogeneous age profile among ENCH employees. The single sample t-test examined whether the average willingness differs from the midpoint value of 2.5. The results showed failure to reject the null hypothesis, showing that willingness to participate is anything other than neutral. The z-test compared the proportion of willing respondents between salary groups. Since the p-value is greater than 0.05, there is no statistically significant difference between salary groups. The one-way ANOVA tested whether age affects willingness to participate. The result also showed failure to reject the null hypothesis, meaning willingness does not significantly differ across age groups. The Pearson correlation analysis examined the relationship between respondents' perception of the cooperative process and their willingness to participate. The test revealed a result of 0.624 signifies a moderate to strong positive linear relationship between two variables. This indicates a significant relationship between perception and willingness. Respondents with more favorable perception tend to show higher willingness to participate.
For San Luis District Hospital, statistics were used to summarize respondents' characteristics. The frequency table shows that the largest group of respondents falls within the 11 to 15 service years, with 16 out of 30 respondents. The 0 to 5 range include 10 respondents, while the 6 to 10 years range has the fewest respondents of 4. This indicates that responses are concentrated towards the upper range of the scale. The mean average of 8.83 lies within the 6 to 10 years class, and this shows that the majority of the respondents have long been serving the hospital. The median 11.75 falls within the 11 to 15 class interval, meaning that at least half of the respondents belong to the lower half of the median, while the other half belong to the higher half. The model class is 11 to 15 service years, which has the highest frequency, and this confirms that the most common employment years among San Luis District Hospital respondents are long tenured. The standard deviation of 4.85 indicates low variability in employment years, suggesting that respondents' age are closely clustered around the mean of 8.83 years, and this reflects a relatively homogeneous age profile among San Luis District Hospital employees. Inferential statistic tests were also applied to respondents from San Luis District Hospital. The single sample t-test showed failure to reject the null hypothesis, indicating the participants' willingness to participate is anything other than neutral. The c-test, comparing salary groups, resulted in a p-value greater than 0.05, which means that the proportion of employees who are willing to participate is the same between two salary groups. The one-way ANOVA tests whether years of employment affects willingness, and the results again showed no significant differences among employment groups. For the Pearson correlation analysis for San Luis District Hospital, it revealed a p-value less than 0.05, leading to the rejection of the null hypothesis. Having a result of 1 for R signifies a perfect positive linear relationship between two variables representing the strongest possible association where one variable perfectly predicts the other. This indicates a significant relationship between perception of cooperatives and willingness to participate. Respondents with better perception are more willing to engage in cooperative establishment.
Statistics for Norzagaray Municipal Hospital were likewise applied. The frequency table shows that the largest group of respondents belongs to the 21 to 30 age bracket, followed by those aged 41 to 50. Next is the 31 to 40 group, while the 51 to 60 group has the fewest respondents. This indicates that respondents are predominantly younger to middle-aged employees. The mean age of 36.83 years indicates that, on average, respondents are in their mid-career stage, suggesting practical experience while still being actively engaged in hospital operations. The median falls within the 31 to 40 age group, meaning that half of the respondents are younger than this range and half are older, confirming a balanced age distribution centered on early to mid adulthood. The model class is 31 to 40 years, which is the most frequent age group. This shows that middle-aged employees from the third largest segment of respondents. The standard deviation of 10.41 reflects moderate age variability, indicating that while age vary across respondents, they remain reasonably clustered around the mean without extreme dispersion. Inferential statistics tests were conducted for Norzagaray Municipal Hospital. The single sample t-test resulted in failure to reject the null hypothesis, showing the willingness to participate is anything other than neutral. The z-test showed no statistically significant difference in willingness between salary groups. The one-way ANOVA also showed failure to reject the null hypothesis, indicating that years of employment do not significantly affect willingness to participate. The Pearson correlation analysis for Norzagaray Municipal Hospital revealed a p-value more than 0.05, leading to failure to reject the null hypothesis. Its R value is 0.3401. This indicates a weak, positive, but not statistically significant relationship between respondents' perception of the cooperative process and their willingness to participate.
We also did a combined data analysis for three hospitals. We made two chi-square tests for this research. The first chi-square test using the chi-square calculator for 5 by 5 contingency table examined whether there is a significant association between age group and the hospitals. The computed chi-square value is x squared is equals to 16.43 with a p-value of 0.0116, which is less than the zero point zero 0.05 significant level. This result indicates that the null hypothesis is rejected. Therefore, there is a statistically significant association between age group and the hospitals. Observed data indicates that El Nido Community Hospital has a higher proportion of younger employees, which especially ages 31 to 40. San Luis District Hospital has more employees aged 51 and above, and Norsagaray Hospital shows higher representation in the 20 to 30 and the 41 to 50 age groups.
Another separate chi-square test using chi-square calculator for 2 by 2 contingency table was conducted for the three hospitals to determine whether there is a significant association between perception and willingness when grouped by health versus non-health respondents. For both El Nido Community Hospital and San Luis District Hospital, the chi-square value is 0 with p-value of 1. For North Arcaday Municipal Hospital, the chi-square value is 0.0467 with a p-value of 0.829. Since all p-values are greater than 0.05, the null hypothesis is not rejected in all three hospitals. This indicates that there is no significant association between perception and willingness across health and non-health respondents. In summary, respondents' perception and willingness appear to be independent of their classification in the three hospitals.
Our conclusion in terms of willingness and perception means across the surveyed institutions, there is a general positive perception and a high level of willingness among hospital staff to participate in a cooperative model. In terms of cost advantage, data comparison reveals a stark price gap between hospital source items and outside retail price. For example, the gauze costing 30 pesos per pack internally versus 95 pesos externally. A cooperative could benchmark price points from external price data to support sustainability. In terms of market demand, the high turnover rate for essential items like sterile gloves, syringes, and IV tubing compares a consistent demand that a cooperative can fulfill more reliably than current fragmented supply chains.
Our research demonstrates that there is a critical and recurring shortages of essential medical supplies in rural Philippine areas, forcing patients to source items from distant urban centers, significantly increasing acquisition costs. Our survey findings show that employees have an encouraging level of willingness to take part in cooperatives. Although salary, age, and length of employment do not directly affect participation, these factors shape how employees view cooperatives, which in turn influences their willingness to get involved. The strong link between perception and willingness suggests that participation can be improved through better information, awareness, and education. In addition, the higher cost of buying medical supplies from external sources, which include transportation costs, highlights the financial benefit of using cooperative-based solution. The study concludes that cooperatives have the potential to serve as an alternative solution provider for affordable medical supplies in rural areas.
To ensure the successful implementation and sustainability of the proposed cooperative model, the following actions are recommended. The cooperative should initially focus its procurement and inventory management on the top 5 medical supplies identified in the study. Example, gauze, syringes, gloves, IV tubing, and saline solution to ensure rapid capital rotation and immediate impact on affordability. Since the research found a strong link between perception and willingness to participate in most hospitals, the researchers recommend the hospitals to encourage their staff to attend seminars hosted by Cooperative Development Authority or CDA on benefits of cooperatives to further increase staff engagement knowledge, and membership. Beyond selling medical supplies, the cooperative should plan alternative revenue generating activities such as franchising or secondary health related services to ensure long term financial success and stability. Given the positive findings in the three target hospitals, these models should be proposed as a pilot program for other rural district hospitals in the Philippines facing similar supply chain.
In conclusion, the study underscores the promise of cooperatives as a practical and sustainable solution to medical supply challenges faced by rural healthcare institutions. Through effective management, increased awareness, and strong collaboration among stakeholders, cooperatives can play a key role in providing a reliable, affordable, and continuous supply of medical supplies. Thank you very much for your time and attention.